In India, the country where I am from, when there is a situation where you are suffering from some illness or when your health goes on a toss, then the amount of money that we splurge when, if and when we have the ability to take care of ourselves, or like financially, if we are very well off, then the amount of money that we splurge on the event like this is immense. Let's say you are covered with the insurance, and yeah, even when this is the case, so there can be so much complications with regards to, okay, your insurance only covers to XYZ illnesses, and you have, I don't know, some different illness where the insurance is not covered, and then they say that, okay, you are not allowed to go to XYZ hospital, you can only go to this and other particular hospitals. And also it could be that they might not cover the whole expenses of whatever that had happened to you. So I have experienced this thing firsthand in India, and today what I'm going to share with you is my own experience and my own story about how things worked out and how things actually work in Germany. It was a very normal Saturday for me. I got up from my sleep, had my daily routine, then had a really nice breakfast with my wife, and then at about 11 a.m. we hit to the gym. So after coming from gym, I was also completely feeling fine, and suddenly from 4 p.m. onwards, my stomach started paining like crazy. I was completely unaware of the fact that what exactly happened, because what I ate on that particular day was a very normal breakfast that I usually have over the weekends or even over the days, and I was completely unaware of the fact that what is happening. So it started paining, and the pain was so intense that I was like, okay, yeah, I'm not able to, but I'm someone who do not, or who hesitates to take the medications as and when something starts happening to me, because I try to get it healed by itself. But the pain was so intense, then I took some painkillers. Even then, nothing worked. So the whole evening I just spent with this pain. I was walking around our house like crazy, like sitting in different position to somehow see if the pain get reduces or whatnot. And by 10 p.m. nothing happened. Even with the painkillers, nothing worked. So we decided to go to an emergency hospital in the night, and there the doctor scanned my stomach with this ultra scanning thing, and then she also checked my blood, and the reports also said nothing is wrong. So at that point in time, so she realized, or like the doctor realized, that okay, it's something maybe related to indigestion or whatnot, because they were not able to see anything, and recommended me some medication. And we got the medications, came back home with the hope that after taking these medications in the morning, I'll be fine. I took the medications that they suggested, or like that they prescribed for me, and then even in the night, pain did not reduce. So it was so much paining such that I was not able to sleep in the night. And then in the morning, and my wife decided, okay, this is not gonna work, let's call the ambulance. So my wife called 112. So that's the emergency number in Germany for the health problems, and also for other emergencies, I guess. I'm quite not 100% sure, but definitely if you call 112, then you will get the ambulance. That's what I know for sure. So she called the ambulance, and the ambulance was here at our place in 15 minutes. So this is the first time I was facing a situation where I had to be calling the ambulance. So I've seen ambulances from far driving around all over Germany, but this is the first time that I saw an ambulance to take care of me when I'm having a problem. So it's literally like a mini hospital. So basically, the guys who drive and take care of the ambulance, they got like a mini computer kind of thing to our home, which diagnoses like the blood pressure, oxygen level, and whatnot. Then they asked me like all the things that I'm facing, and then they decided that okay, it's an emergency, and then they took me to the ambulance. I onboarded the ambulance. So the only thing that I need to do when something happens is that I need to just tell them what is the scenario, or like what is happening with me, and then they decide, okay, which hospital is the best for a particular scenario. So I don't have to be telling, okay, hey, go to this hospital or go to that hospital. I mean, being an immigrant, you are not 100% sure about which hospital has the best care or whatnot. So that's what I just did, and they took to the best hospital near to the place where I live. And after doctor diagnosing, they diagnosed that I might have appendicitis. So they, as appendicitis is something that they need to be quite quick, so they just told me that around 7 a.m. the doctor diagnosed that it's an appendicitis, because my pain went and settled in the right side and the lower abdomen where the pain was intense. So on that basis, they said that, okay, this is an appendicitis. Then they told me that, okay, we have to operate now in another 1 hour. They made ready for the operation. And before this operation, the doctor came to me and told me that, okay, this is how the procedure would look like, and this is what the complications might be. It's not that it will happen to you, but this is what the risks are, and this is the anesthesia that they will be doing, and just explain me the whole procedure that they will be following. And at around 8 or 9 a.m. I was taken to the operation theater to get the operation done, and thankfully everything went super well, so there was no complications. The operation was a success, and I was staying in the hospital for 2 days just for the observance, and then I got discharged after 2 days. So even during this time where I am in the hospital, so the food will be taken care of. There will be an emergency doctor all the time. There will be nurses all the time where you just have to click the button and then the nurse just appear in front of you. So this is the level of service that you get. I mean, it's not only me getting, it's literally 83 million Germans who are living in Germany. They get the same exact service when they are registered with the public health insurance, which is basically majority of them. Yeah, so this was the episode, like 2 days to 3 days had pain, and then after a week or one and a half week, the pain is gone, and I was feeling super well. So it's, by the time of this recording, it's been almost 3 weeks that I had the surgery, and I'm feeling super fit now, and everything is fine. So if you ask me, like, okay, everything happened and what is the cost, then I would say it's €0. It's literally €0. So that is one thing that I really love about Germany, and I hope that everywhere in the world this is what should be, kind of, because the level of stress that you'll be having while going through the pain that you have is, first of all, completely off, and then if you get the stress of financial stress, then it's completely off. And also when you get the service here, it's top class service that you can get when you are sick, and until the time you are recovered, you will be taken care with the paid leaves. Like, you will get the certificate from the hospital which you submit to your employer, then you are having like a paid sick leave. So the financial stress is completely zero. And so this is something that I wanted to share today in order to showcase like how well the healthcare system is in Germany, and me experiencing this firsthand is something I'm super thankful. And so just wanted to share this story out there today. I hope this gives you the feeling about how healthcare looks like, and if you are someone who is also planning to come to Germany to make your living, then it could be a nice information to have, where I'm sharing with you the real story that I went through. Let's say that you are a family where you have wife and 1 or 2 kids. Then let's say you are the only earning person. Even then, your wife or your spouse and your children are health insurance covered. Like, do not have to be that you have to buy the health insurance. You are the only person who is working and earning in the family, and then your spouse is not earning and you have kids, then all of you in the family are health insurance covered. So, and they all get the same level of service that I just mentioned to you. And this is how the system is in place in Germany. So if you are looking for a very socially secured country, then to be honest, according to me, there are very few, I guess, in Europe as well. So even Netherlands, I heard it's really nice, and also Denmark, Norway, and all the Scandinavian countries. but with the amount of opportunities that's also available, I would say you should not look further away from Germany. So here is my short story, which might help you to take the decision that you might be thinking about. I wish you a good one. Have a great day ahead.